an original MCM production.
What's going on? What's going on? What's going on? Yeah, what's going on? What's going on? In the meantime, right?
Hello and welcome to What's Going On, the Martha Love Show. I am your guest host today, LaToya Sykes, and I'm pleased to have in studio members of Children's Community Health Plan. So I want you to all say welcome to my guests. We have Mrs. Ophelia Carr.
Hello.
Who's a Case Management Outreach Coordinator.
Correct.
Mrs. Susan DeGraff.
Yes.
Who's a Case Manager and Registered Nurse. Yes. And Mr. Anthony Hurd, who is a HMO member and advocate. Advocate.
HMO member advocate.
HMO member advocate. Welcome.
Thank you.
So we're going to get started right away. We have some questions for you.
Okay.
All right. The first question, Ms. Ophelia.
Yes.
What are our standard procedures after a client is discharged from the hospital?
Well, standard procedure is just giving a member a call once they get home, seeing how they're doing, asking if there are any questions, any concerns, any information that they missed when they was in the hospital. So it's my role is to make sure they have a primary doctor to see them after they get out the hospital.
That is very important. I remember going to the hospital with relatives and they don't have that. But tell our audience why that's important.
It's important because you need to know who's going to take care of you if you get sick again. If you go into the hospital, at least you have a doctor who knows your history, know who you are, have some form of information about what health factors that you may have that they didn't know about before, and just having a doctor to talk to when things come up.
Great. So who is the childless adult population?
Our childless adult population are those members or people in the community who did not qualify for the HMO, Children's Community Health Plan, standard plan, who do not have children. So they're considered the childless adults. And they have children that's maybe grown or just never had any children. So that's the population that I work with on a daily basis.
Okay, great. So how many are in the childless adult population?
Roughly about 550 plus people. That's just for March only.
So how do you identify this population? Are they self-identified? Like, how does that work?
It's identified by the state of Wisconsin, by
Okay.
the Medicaid system.
Okay, great. So how important is it to recognize this population? So I happen to be one of those individuals in this population.
Okay.
So I really want to know, I want everybody to know, how important it is to you to recognize this population.
Well, it's very important. Everybody should have health care.
Yes.
Everybody should have a good health care system, have a health care provider that listens to them, not just to anybody. So it's very important to make sure you get the right services at the right time.
Okay, and how do you engage and follow up with this population?
Phone calls, reach out. If members need information, I send resources to them. I also send my business card because you may not want to speak to me at the time when I'm talking to you, but you may call back months later saying that you need something. And I always tell members, if I don't have it or I cannot find it, there's a team around me that can answer those questions for me too.
Awesome. Thank you, Ms.
welcome.
Ophelia
You're
from
welcome.
our Children's Community Health Plan.
Thank you.
Now to you, Ms. Susan.
Yes, ma'am.
What is a PNCC?
PNCC stands for Prenatal Care Coordination. It's a state benefit that's available to all members of BadgerCare Plus, pregnant women who the program is available through their insurance companies and also through other organizations. Okay. Our PNCC program is called Healthy Mom, Healthy Baby.
Okay. So what are the goals of the program?
The goals are, the reason we named it Healthy Mom, Healthy Baby, the goals are to assist the member to have a healthy pregnancy. We want them to get to term. We have things that we like to talk about. We like to talk about safe sleep and breastfeeding and having a plan for birth control afterwards. But it is a member-driven program. It's a voluntary program. And so the goals are set together with the member, with the pregnant woman. She gets to set the goals for how she'd like to spend her time with us.
Good. How does a pregnant woman get involved?
We get lists from the state when a member qualifies, when they are a new enrollee. Okay. A lot of people do not have health insurance or do not have access to an HMO until they are pregnant.
Oh, okay.
In Wisconsin, virtually every woman who is pregnant qualifies for BadgerCare Plus, and qualifies for this program. Among the other benefits of BadgerCare Plus, they usually have no copays and no deductibles during the pregnancy. Okay. We get a list from the state, therefore, of those members who qualify. We also get letters from OBs, the doctors themselves. We have a process that rewards them for letting us know when they have a member of ours who's pregnant.
Okay.
They can also contact us directly, and so a member can somebody who is a member of our health plan can call our line directly and enroll in the program.
Awesome. So what is the eligibility requirements?
If they're eligible for BadgerCare Plus and they are in Children's Community Health Plan, then they almost always qualify for PNCC, for HMHB.
So someone might say, well, how do I know if this program is for me? How will we get that question answered?
I think that the idea is that it's educational, but it's also about just having an extra person of support. Almost everybody needs a team.
Right.
And whether you have a partner who's supportive, a family that's supportive, or maybe you don't, the prenatal care coordinator is somebody who comes alongside you to provide extra support and becomes part of your team to help bring all the pieces together. So the coordinator part of it is about making sure that the healthcare provider, the OB, and the member and her family and any other referrals that she might need are all on the same team and working together towards the good of that mom and baby.
Oh, awesome. So then where do you meet?
Usually we meet in the member's home. If she's not comfortable with that, we'll meet just about anywhere. It's a home visiting program, but that doesn't mean it has to be your home. It can be McDonald's or Starbucks or your doctor's office or the library if somebody's not comfortable with meeting in their home.
Okay, great. So how often do you meet?
We usually meet about once a month. The state requires once a month. Some people want to meet more often than that, and we're able to do that as well.
That's good. So when you have a meeting, so what does the general meeting look like?
It looks a lot like this.
Okay.
Except that we're probably in somebody's home and there are probably children and dogs underfoot.
Nice.
So
that doesn't cause a problem.
I love that part.
Awesome.
I love that part. It really is. We are nurses and social workers, and but we are not coming in and taking blood pressures or doing weights or doing any of the things that the medical provider does. We are meeting in a collegial partnership with that mom and whoever else that she'd like to have with her. So sometimes they're dads and grandmas and other people involved. And we work on the goals that we've set together. So the first meeting, we get to know her risk factors and her goals. And then from then on, we talk about that and do education as she'd like.
Okay. So what are some of the questions that the prenatal care coordinator may be able to help answer?
Things about the medical care, certainly. A lot of people are seeing an OB, but don't really understand, don't get the questions answered about the physical process of pregnancy. Most people don't talk to anybody about the emotional changes that happen with pregnancy.
That's very true.
And those are as predictable as the physical changes, but nobody ever tells you that. We also really are focused on making sure that our member gets dental care because that's very important during pregnancy. And because she has great access to insurance at this time, we want to make sure that we take advantage of that. A lot of our members struggle with emotional or behavioral problems and need counseling or need that kind of support. Those are things that we can help with. We love to do the educational part of it, but that's only part of what we do. Certainly we can educate everything about normal pregnancy and labor and delivery and breastfeeding and baby care. But also, like I said, the biggest component is that personal support.
Great. So if I'm hearing you correctly, my prenatal care coordinator can help me address things like when I should go to the doctor, how will I get to the doctor, like what are signs of labor.
Exactly.
And any other questions that I have, especially when this might be my first time going through this process. And I love how you share to talk about some of those other things that are related to your pregnancy that you may not automatically identify as part of the process.
Right.
And things that you don't think to ask questions about because you don't think of them as part of the process. I like that. And then I'm assuming this person can also help with what my baby may need.
Absolutely.
So help answer that question.
So it's getting ready for the baby, and that isn't just about the physical changes or the medical care. It's also about, do you have a bed for your baby, and do you have a safe place to live, and are you hooked up with the resources in the community that are available to you to help your family function at a higher level.
Awesome. So let's go back to if we have the visit in my house or whoever this person happens to be. So who is this person? Who's coming to my home? What's their background? Do they have kids? For that person that's new to this process, help me help them feel comfortable.
Well, the members of our team are social workers and nurses.
Okay.
Not every PNCC program is that way, but we have a pretty high level of education and experience with our prenatal care coordinators.
Okay.
Social workers and nurses, and they may or may not have kids, some probably about half and half as well. but they are, for the most part, very experienced in the community and have spent a lot of time with families, working with the community, have a good understanding of what's available.
Okay.
And we also work on this team. The advantage of being a PNCC program that's housed in your HMO is that we work with a team that has advocates available and has a dental advocate who you'll meet in a little bit, and has nurses who can follow up and can track where things are going with your medical care and with your insurance. I'll turn to Anthony if a member has a question about their coverage or they're having issues getting access to medications or to other services.
So let's talk about flexibility then. I guess my last question for you. So how does that look if I start out and I say, I'd love to meet once a week or once every other week, but then I start working and my schedule changes? How is flexibility handled?
Well, we visit Monday through Friday from early morning to early evening at the convenience of the member. The question sort of also brings up the idea that if somebody got to the point where they could not visit, it just was not practical during that pregnancy, and this has happened for people, we can also do phone visits, and we can meet at the OB's office at the same time you have your appointment, so you can meet something. But it's very, very individual. Certainly our schedule changes every day, and it's meant, we're usually very much in contact with the member by phone and by text, and we're very flexible.
Great. This is awesome. So my prenatal care coordinator is really one of my teammates.
Exactly.
You know, I get a chance to ask you all the questions to help me feel comfortable with this process and to have you walk through the process. And I love the fact that I could have you join me at my doctor's visits if that, happens to be a good place for me, because when we're going through this process, it's the first time and you really don't know what to do. Sometimes having your advocate there where you can go through your questions will help you, one, not forget some of the things that you want to ask, and two, help you follow up with some other questions that you may not already know to ask. So, great. This is great. All right. Thank you, Ms. Susan.
Thank you.
All right, Mr. Anthony,
Yes.
you're up next.
All right.
Tell me a little bit about what function does the Children's Community Health Plan play in providing needed resources to the community as well as their target member population?
All right. Well, that's pretty much the area that I'm in. My job is to educate the members regarding their medical providers, the medical benefits that they're covered for, how to get their bills paid should they come across some. And there's maybe a loophole that they've fallen through where they're not able to get access to providers, specialists, dental, various things like that. So not only do I do that in-house, but I also go out into the community, per se some events, maybe resource, health fairs, various things like that, that would be able to give the Children's Community Health Plan an opportunity to be seen and access the members and engage with them and provide the information that they need in order to get the care that they deserve.
I have to say that in looking at the opportunity to talk to you all today, I looked at your position and as an advocate, and I recall seeing you at different events in the city.
Right.
And I never realized the magnitude of help that you're here to provide. So I didn't know that I could really come to you and say, Anthony, I need an advocate, let alone all the other services. So let's talk about those services. What other services are offered by advocates?
Well, the actual access to resources like behavioral health, dentistry, specialty care, and then we have some caveats that would include access to getting a hold of food resources, housing, clothing, and various things like that, as well as utilities. So we have a plethora of things that we do provide for the members as well as the community, and so that they'll understand exactly what they need to do in order to get assistance.
All right, great. I'm overwhelmed, but I'm really appreciative to have you here to share this information. So where would a member of the Community Health Plan call to get this assistance?
Sure, they can contact 1-800-482-8010.
So 1-800-482
8010.
8010.
Yeah, also I'd like to just throw in there too, we also have a website, which is childrenscommunityhealthplan.org.
No, I had that. childrenscommunityhealthplan.org. That's
Right.
childrenscommunityhealthplan.org.
Yes, ma'am.
Okay, great. And so I can call that number if I'm experiencing dental-related issues.
If you're experiencing dental-related issues, you need access to any type of specialist, vision care, behavioral health, anything like that, or if you may have received a bill in the mail that you know you were covered for those dates of service,
Okay.
you'll be able to contact number, and they'll be able to resource you. And actually, that number will go to all of us. Okay, so what does that mean? It's a connection between the HMO member advocates, the PNCC department, as well as Ophelia's department, and then you'll be able to get access to whatever you need. We are all one big team. I know that words keep appearing in our conversation, but it really is true. Children's Community Health Plan is a huge team of resources that we provide and work towards assisting our members.
You know, it seems like a novel idea to have Children's Community Health Plan work as a team and to be able to contact one person, and because you're interconnected and you're communicating, you know, have the right person get back to me. So I am very impressed and excited to have a great team come together like that. So how does an advocate help our members, and what role does that person play?
Well, it's often one-on-one, and it can be either, if we're in the community, it can be one-on-one, face-to-face.
Okay.
If we're on the phones, same scenario. Whatever the situation is, again, we can go down the line. If you need a medical provider, I can get you access to that.
Okay.
If you're having difficulty scheduling an appointment, I can help you with that. If you're having difficulty having a bill paid or having a service approved, I can assist you with that. If you have questions about what is covered and what's not covered under the HMO plan, I can assist you with that.
Okay. So what are the business hours you can reach an advocate?
7:30 a.m. to 6 p.m. in the evening.
7:30 a.m. to 6:30 p.m.
6 p.m. in the evening.
6 p.m. in
Yes,
the
ma'am.
evening. Okay, great. And then how can a member have access to the providers that is in network with Children's Community Health Plan?
They can either check it by way of our email website, or they can give us a call, and we can search them out for them and make sure that the connection is made.
Okay, great. So one more question. How can I meet my advocate?
Right here.
Ah!
No, actually, we're actually very functional within the community. Like I say, in various resource events, health fairs, resource fairs, employment fair. We're doing them all. We do several of them several times a year. Okay. Quite often during the summer months. But you know what? If ever you want to really meet an advocate face to face, you can give us a call. You can make a connection and come down to our office, and we'll be glad to meet you.
Let's get that number one more time.
1-800-482-8010.
And the website is Children's Community Health Plan. Thank you for joining us, and thank you all for being here to share this awesome information.
Thank you.
Thank you for having us.
Thank you.
What's going on? What's going on? Yeah, what's going on? What's going on? In the meantime, right?
Hello and welcome to What's Going On, the Martha Love Show. I am your guest host today, LaToya Sykes, and I'm pleased to have with me today members of the Children's Community Health Plan. And we will be speaking with Vivian Watson, who is Outreach Coordinator for Care for Kids, Tim Rifle, who is Utilization Case Manager for Behavioral Health, and Saraid Rosario, who is a Community Health Navigator. So we'll start with you, Vivian, and I have a couple questions. I'll just ask my questions and we'll move right along. Sounds good?
Sounds good.
Awesome. So welcome to the show.
Thank you.
Tell me, what is Care for Kids?
Care for Kids is a program that creates a medical home for children who are placed in out-of-home care, as in foster care. The medical home is not exactly a brick and mortar place. The medical home consists of a team of an outreach coordinator such as myself, there's 2 of us, along with a healthcare coordinator. And we make certain that every child receives an individualized treatment plan that speaks to healthcare needs, mental health care needs, just to make certain that those children receive exactly what they need in order to increase their resiliency once they return to the community.
Wow. So when I learned that you were going to be on the show and what it is you did, I was very thrilled, because there's a lot of children who are in situations where their health records do not follow them from home to home. So tell me a little bit about what the specific goal of the program is.
Well, I would say that the specific goal of the program is to make certain that these children receive timely and developmentally appropriate services and care.
Okay.
For example, the children who come to our program who are between newborn and 6 months of age, the program requires that they are seen on a monthly basis from the newborn until they are 6 months of age, because that time frame is really very critical for those children. So we're keeping on track of them as far as those appointments, making certain that they occur and that they occur with those providers who are trained specifically to provide care for these children.
Awesome. So in our world of acronyms, tell me what TIC stands for.
That stands for Trauma-Informed Care.
Okay.
In other words, the providers who are trained in trauma-informed care are trained to address all types of trauma, not just physical, but psychological trauma as well, and not just saying the traditional question of what's wrong with that person, but what has happened to that person, and moving forward to obtain the information that speaks to their experiences that brought them to that caregiver.
Okay, great. So help me understand the role difference between the healthcare coordinator and the outreach coordinator.
As an outreach coordinator, my role is initially to reach out to that caregiver who, for example, has just received a child in their home. They're brand new to Care for Kids. I'm the voice that they hear that calls and says to them, this is Vivian calling from Care for Kids. I want to introduce you to the program. This is what we're looking at for this child for this particular age that needs to be seen by the provider. And maybe as a result of their initial appointment, I'm looking at the records before I call. I see that they need to be connected to, for example, a mental health provider. So there could be something, reverting back to the trauma-informed care, that maybe that I need to keep in mind that this particular child needs to see a gender-specific provider. Maybe their trauma was related to something that speaks to that, so I have to keep that in mind. Along with the caregiver, I have to keep in mind what their available hours are to make certain that they're able to get the child to that particular provider.
So that is really great. And that is the role of, the healthcare coordinator or the outreach coordinator?
The outreach coordinator.
Okay, and then the healthcare coordinator does what?
The healthcare coordinator could either be someone who is a registered nurse or an advanced practice social worker.
Okay.
In my team, my healthcare coordinator is a registered nurse.
Okay.
So the distribution of the cases, if you will, that come in for children who are more medically fragile are typically assigned to the team that works with a registered nurse. Children who may have more mental health issues would be assigned typically to the team that includes an advanced practice social worker.
Okay, that's great. So in these two positions, the healthcare coordinator and the outreach coordinator, can you tell me a little bit about the backgrounds that the team has?
Our team has a very diverse background in a very good way. We have varying experiences with the outreach coordinator. The requirement education-wise is that you have a bachelor's degree. A lot of us come from backgrounds of child welfare. Some have other experiences as well. And because we work in a team, it always comes out in a very positive way because we're able to tap into each other's skills. And even though we work in separate teams, we still cross the line sometimes when we have to come together and maybe there's something going on a team that has an advanced practice social worker that they need to speak to a registered nurse. And we all come together because the ultimate goal is to provide the best care for that child.
Okay, great, great. So tell me, or actually give me some examples of how the team helps navigate behavioral or dental or medical needs for a kid.
For example, with the dental, oftentimes our children come in with dental caries, another word for cavities. And
dental caries. I've never heard that one.
Yes. So we have to speak to that pretty immediately. And we'll get them in to see a dentist. And we look at, as the outreach coordinator, before I call the caregiver, I see where they live. And for example, if they live in a particular side of town, I introduce them to the fact that Children's is within the community. So there's, for example, a children's dental clinic that's on 50th and North. And maybe I say to them, I see that you don't live far from there. I can get you into an appointment there so that you can be seen. So it's always, the expediting part is always to try to get the child in as quickly as possible.
Right. That's really great. So tell me examples of how you expedite that care. So what is it that you do to help get that child in to see someone as soon as possible?
If the child has, the referral, for example, is one of mental health.
Okay.
Oftentimes that will require a parental consent prior to the appointment. So I make certain that I express that to the caregiver, that we need to get that taken care of. So that means that I'm reaching out to the ongoing caseworker, because the work that I do is primarily behind the scenes.
Okay.
So that ongoing caseworker would be in a better position than I am to actually reach out to the parent, as in going out and getting those consents, to make certain that when that child attends the appointment, that everything is in place, that nothing is missing that could potentially make the appointment take longer or have to be rescheduled. We want to make certain that everything is in place.
So what I hear you saying, you help to break down those barriers.
Exactly.
So how do you do that, and keep it individualized for your kids? How do you break down those barriers, prioritize what may need to happen for that child, and help get those services delivered?
Sometimes there are certain cases that you see more often where maybe there is speech delay, and then the child needs to get in for a hearing test. And then it comes back that maybe the child needs to have tubes inserted in their ears. So whatever, depending upon the level of care as to how you proceed, but every child is important to us.
Okay.
There is no child that is not important to us, so we still move forward with the same intensity as far as making certain that I've touched bases with who needs to be bought into that part, whether it's the ongoing caseworker, maybe it's the caregiver, it's the biological parent, because we're still working with the parent as well.
Okay, great.
And we do have parents who, although their child is no longer in the home with them, they still attend the appointments. They still want to know what's going on with their child. So we are sensitive to that.
Okay, great. Thank you. So let's move over to my utilization case manager, Mr.
Yes.
Tim.
Hi.
Can you explain a little bit about your role as a case manager?
Yeah, when we pick somebody up for case management, the idea is that it's somebody who's likely been in the hospital quite frequently, been inpatient. So we really choose the members that we case manage carefully off of that list, and then the idea is getting into the home and seeing what's going on. What's brought them into the hospital to begin with was typically some sort of behavioral health need, whether it be depression, anxiety, or suicidal ideation, or substance abuse issues are typically the main ones that bring somebody inpatient. But when we get involved in the house, we realize why it is that's continuing to happen, why they're not following up with their outpatient programs once they discharge. It's because they're having issues with paying the rent, getting food in the house, or they don't even have a house to live in or a place to call home. They've got kids in daycare and they can't afford that. So a lot of the times those behavioral health needs, as much as they're right in the forefront and very present, need the assistance of somebody like myself to come in and say, okay, let's get some of these things taken care of. And I can utilize somebody like Sally E here and picking up the, finding different resources around in the neighborhood, whether that's rent assistance or, finding some food or ways to get the food stamps, and all those things are really, really what they need in order to help them kind of stay out of the inpatient facilities. And then when some of those things are taken care of and they got that stress off of their plate a little bit, we can start incorporating some of the behavioral health needs, following up with therapy appointments, continuing with their med management and along those lines.
So how do you work with your coworkers to ensure that the Children's Community Health Plan members are receiving the services that they need?
Well, like I had said, with Sally E, it's talking with her and figuring out if I don't know an answer about how somebody can get certain community resources, I'm going to pick her brain about what she's got out there that I don't know of, because she's got some experience and knowledge that I'm not aware of. And when it comes to some of the kids, for the other half of my job, the utilization management piece, we see these kids come in and we do the insurance reviews on them. And that's a lot of the times for Care for Kids with Vivian, that they don't know that these kids are, inpatient, and they don't know the status of it because it's not as frequent. Where, when I see it that there's an inpatient, I, shoot an email out saying, hey, this member is currently in the inpatient facility, and that gets them involved with the treatment team at the facility that they're at, so that we make sure that all parties that are at CCHP know everything that's going on, because otherwise they're kind of left in the dark of like, oh, they were in the hospital 3 times in the last month, and they were completely unaware of it. And we want to get as many people involved as possible in order to be able to help and have the healthiest kids around. We are under the Children's Hospital realm, and they want the healthiest kids in the country. And at CCHP, we want to have the healthiest members for all of that. So we want to make sure that everybody that can be involved is involved.
So we all know that when you work with kids and they have illnesses or some other thing that they may consider hanging over their head. Can you tell me how you deal with that? How do you work with reducing the stigma surrounding certain illnesses or diagnoses?
There's a big challenge with that right now. Unfortunately, mental health, behavioral health itself right now has a bad rap. It's really put out and portrayed negatively in the media. And right now we've got a handful of different things that we're trying to do, partnering up with a variety of communities. That's kind of what separates us differently at Children's Community Health Plan, is we are trying to partner up with as many people as possible. And that's not just being a sponsor for something, that's actively being involved. I've got 2 examples. One is with NAMI of Greater Milwaukee, and that's the National Alliance on Mental Illness.
And that's the National Alliance on Mental Illness is one of the partners.
Yep. Okay. Yep, and it's of Greater Milwaukee, so it's a national organization, and there's a Greater Milwaukee branch, and we've been partnering with them very closely with a lot of things that they've got going on. One that's coming up soon is a walk down on Veterans Park, and we've got the whole behavioral health team as a part of it. We're encouraging the rest of the CCHP to be a part of this walk as well, and just get it out there, get the awareness out. And me personally, we're trying to get donations, so this is a nice thing about social media.
Yes.
I can post on there just saying, hey, looking to get a donation. Can you help out? We're just trying to reduce the stigma, and that alone, draws a ton of attention to it. I've got friends that I didn't even know might be struggling with some of these issues that had commented on a statement like that, and so it's right there for me. That's kind of proving its point. And the second piece, the second organization that we're teaming up with is a play in the Milwaukee area called Pieces in My Own Voice. Okay. And it's a local play that's being done downtown, and it's basically just a variety of different disorders and diseases, mental health diagnoses, depression, schizophrenia, and it's putting it into a perspective. So not a lot of people know and understand what's going on. And something that I took from it personally was one of the characters was talking about how they don't identify themselves as a disorder, so why is everybody else? Okay. So if somebody's got cancer, you're not saying, well, hey cancer, how's it going? You look past the person, it's, oh, I'm so sorry you have that, and then you try to do what you can to help. But if somebody says, well, I have depression, or I'm suicidal, or I'm anxious, it's looked completely different. Somebody else goes, okay, I maybe don't want to be around that person. Mm-hmm. It's even more challenging as a teenager, in college or in high school.
Great. And so that play is called Pieces?
It's called Pieces in My Own Voice, and I'm not sure on the exact times. But
okay.
But
will that be on your website?
Yes, it will be on our website. They have their own website and a YouTube video that kind of has a little glimpse of it too. So if you look up Pieces in My Own Voice, you will be able to find that information there.
Great. Thank you.
You're welcome.
And Ms. Sarai, my health navigator, tell me a little bit about your role.
Sure. Basically what I do is I work closely with families who have utilized the emergency room more so than other families in a short period of time. Okay. And during these phone calls that we make to them to reach out to our families, we kind of talk to our families to figure out what's going on. So we come out to the homes and either help them establish primary care, if that may be the reason why they are utilizing the emergency room rather than using a primary care physician.
Okay.
And a lot of times we also realize that the reasons why they don't have a primary care doctor is because, as Tim was saying, there are many other aspects in their lives that are prohibiting them from using the primary care facilities. And at the times when the emergency arises, they are utilizing the emergency rooms.
Okay, great. So what are some of the things you are doing to ensure the health and well-being of a children's community health plan member?
A lot of this is educating and also empowering our families. So we want to educate our families on the health resources that are out there and that we can help network with.
Yes.
And that can be from helping them establish themselves as a patient at a primary care doctor, or find the community resources that will help them as well as the rest of their family within that whole household to get the best quality care that they can.
Okay, great. So how do you collaborate with your fellow coworkers? Tell me what that looks like for you.
We actually do it on a day-to-day basis.
Okay.
I think that by utilizing our fellow colleagues, we get to bounce off of different ideas. Maybe someone had a family or a member that they've worked with previously who had some of the same needs or concerns, and I may not be as knowledgeable, and by sharing my cases or my families with the colleagues, I get to establish that knowledge where I can better help care for my families as well.
Great. So tell me, how are you working to reduce the stigma associated with certain illnesses and diagnoses?
Well, a lot of that is also educating myself. And I think until I am educated, can I then only be able to assist my families in educating them, but also using our community agencies, find programs or awareness activities that they are also holding, is when we provide our families with those types of resources that they can attend those meetings and neighborhood activities as well that are in their reach.
Awesome. Wow, this team from our Children's Community Health Plan organization is awesome. I appreciate the fact that I've heard multiple times today about how the team works, how you collaborate, how we reduce the stigma behind certain illnesses and diagnosis. So I just have to say I'm so thankful for having you all here today and appreciate all the hard work you do.
Thank you.
Thank you.
What's going on? What's going on? What's going on? Yeah, what's going on? What's going on? In the meantime, right?
Welcome to What's Going On, the Martha Love Show. I am your guest host today, LaToya Sykes, and I'm pleased to welcome to the studio members of the Children's Community Health Plan organization. We are so thrilled to talk to you today. Nasima Zakour, who is a HMO member advocate for Dental, Danielle Cotterall, who is project manager, marketplace development, and Tanisha Collins-Johnson, who is our HMO member advocate. So Nasima, welcome.
Thank you.
We'll start with you. I'll ask you a couple questions. Can you tell me, what is your role as a dental advocate?
My role is basically with, thank you first for having us here. And my role as dental advocate is basically to work closely with members and dental providers, trying to find them dental homes. What we call dental home is basically if a member does not have a dentist prior to calling us or actually contacting us, we're going to try to find them somewhere a dental home to go to.
Okay.
Also is to provide them with the resources and let them know that we have providers in our network that will be helping them out. And if they cannot schedule on their own, then definitely I'll be the one scheduling their appointments with those dentists.
Okay, so what is your background?
I am a dentist who basically trained and graduated from Algeria. And after immigrating to the United States, I worked in the dental field for all those 14 years. And I worked as an instructor for the dental assistant program and the medical assistant program at Kaplan College. Along with, after that, I had actually ran a school, private dental assistant school in Oconomowoc, and then I joined Children's Community Health Plan about 3 months and a half ago, December 14th.
Wow, some great experience there. So
you.
much so, I just had to wonder if maybe I can grab you afterwards and you can look at my teeth. All right, so back to my other question.
Sure.
How do you connect with your members?
So what the members do is either they call the advocate hotline, and so they will get transferred to me, and then we talk to them. Otherwise, we can reach out to those members, trying to find them homes, as I said, dental homes. Otherwise, they are referred to us from maybe their medical or their primary care doctors, nurses, that they find out that, or other departments, that these people or these members need dental care.
Great, and what are your hours?
My hours are usually typical 8 to 5, Monday through Friday.
Okay, and so what are some of the job tasks that the advocates have?
Again, we go back to connecting with our members or reaching out to our members, finding them dental homes. I guess I keep repeating this over and over, but also is to try to expand to educating those members on the importance of oral health, which is, at this point, we find it as being a big deal. And actually, this is one of the barriers maybe the members are having, and also to raise awareness about the dental care among our population.
I definitely have to agree with that. One of the things that I see most in the communities I serve is the need for a better understanding of oral health and how it plays a major role in your overall health and well-being. So
That's correct.
I definitely appreciate having you available.
Thank you.
And Ms. Danielle.
Hi.
So my project manager for
Yes.
marketplace development.
That's
There's
me.
been some buzz in the community about Children's Community Health plan and how it may be entering the marketplace in 2017. So, I'm on a cutting edge, so I want to know, is this true?
It is true.
Nice,
Yes.
nice.
Yes, we're really excited. Children's Community Health Plan will be entering the marketplace as Together with Children's Community Health Plan.
Wow.
So basically, that means that we're going to continue to offer the Medicaid program through BadgerCare, but then we're also going to have another option through the marketplace. So when open enrollment rolls around, I think it's November 1st this year, when people go to enroll or renew their coverage, they're going to see Together with Children's Community Health Plan as an option as well.
Awesome. So tell me why you want to enter the marketplace.
I think for a lot of reasons. I think primarily it's just so we can reach more people. I think as a Medicaid HMO, we know that people aren't always eligible for BadgerCare Plus. We call it the churn. So they go on and off based on their income. And when their income increases and they go off BadgerCare, likely they're going to be going to the marketplace for coverage.
Okay.
So we want to be an option for them when they do. We think it's really important that for parents whose kids may remain on BadgerCare or Medicaid, for them to get the same, not the same, but for them to get health insurance through the same company as their children. So if we're going to cover the kids through Medicaid, we want to cover those parents through the marketplace as well.
Nice.
And then I think the other piece of that, in addition to covering those people that may go off BadgerCare, is really just to expand our scope. I mean, we've been doing BadgerCare Plus for 10 years now. We know what we're doing. We have good experience reducing health disparities and improving health outcomes. And so we want to take that to the rest of the community.
Great. So what would the process look like?
So the process for entering the marketplace, all insurance plans have to become qualified. So basically they have to go through a number of different regulatory things in order to be certified by both the state and the federal government. So the Affordable Care Act sets forth a number of different provisions that all insurance companies have to follow. We have to make sure that we're covering a set of essential health benefits. We have to make sure that we're allowing everybody to enroll based on their health history. So we're all going to be doing that just like the other insurance companies. Once the state and the federal government approve that we're doing everything we need to do and that we're in compliance, we'll get our certificate. And then, like I said, you'll see us on the marketplace in 2017.
Nice.
Yeah.
So who is eligible for coverage in the marketplace?
So to be eligible for coverage in the marketplace, you have to meet a few guidelines. You have to live in the United States, you have to be a resident of the United States, and you can't be incarcerated. In order to be eligible for that lower cost insurance, so there's tax credits and subsidies available to individuals. In order to be eligible for those, you have to not have health insurance coverage already and then be within certain income guidelines.
Okay. And then is the plans available for both adults and children?
Yes, absolutely. And we're trying to really make that point be known. So I'm glad you asked that. I think last year there was about 240,000 people that enrolled in marketplace coverage and in Wisconsin, and I think 223,000 were adults. So we expect our population to be primarily adults as well. You know, whether that's the young adult that just recently got off their parents' coverage, or if it's a person that maybe just doesn't have coverage through their job, like if they work in the service industry, or a family of four. Anybody, we want to cover anybody who's eligible, but we expect the majority of them to be adults.
Okay.
Yeah.
Now, when I look at the marketplace, there's just so many entities listed. How does Children's Community Health plan to stand out in the marketplace?
Yeah, you're right. There are a number of insurance companies out there already. I think a few different things. I think Children's, first of all, Children's Community Health Plan is a nonprofit. We're affiliated with Children's, which I think brings a really good reputation. I think that we have a strong culture of collaboration and innovation and improving health outcomes. So I think those two things really make us stand apart. I also think that we strive and we want to be a high-touch health plan. So the programming that we're offering that you've heard about all day, the advocates for dental and for just our members, the prenatal care coordination, the disease management, all of those programs are they're really available so we can work with our members together to improve their health.
Okay, great. So tell me about what types of plans will be offered.
So when we're looking at the plans, we can't really release any details right away.
Oh, so I'm on cutting edge in that I can let everybody know that it's coming. So that means you're going to come back and let me know before everybody knows about the plans.
That's right. So
Okay.
after we get our certification, probably later on in the fall, right before the open enrollment period, we'll be able to share details about our network and our rates and benefits and everything. But the information about our organization is out there on our website, so that's always a good place to go to.
So if I want to start looking up now to figure out where I can go to learn more, I can go to the Children's Community Health Plan.org website. And remember, that's children's with an S. So it's Children's Community Health Plan.org website. And not only find out about all the great information we've talked about today, but also find out more groundbreaking news as it happens for the marketplace, right?
That's right.
Okay, great. Thank you so much,
You're
Danielle.
welcome.
And my advocate, Tanisha.
Hi.
I have some questions for you. Okay. Tell me, what function does Children's Community Health Plan play in providing needed resources to the community as well as the target member population?
Well, Children's Community Health Plan, we have 3 advocates, and we deal with medical issues in regards to people that has needing finding providers, finding dental, finding health care providers, like if they need to get a health care provider for pediatric, and then if their parents need the health care providers, we find them too. Okay. So we play a lot of different roles. Children's Community play a part in with the members that we serve. It's not only finding healthcare providers. If they have issues, they have grievances, if they have complaints, they can call us. They can call the advocate hotline, talk to any one of us. They can give us their concerns and issues, and we'll try to address those as they come.
Okay. So what services do the advocates offer the members?
We offer them customer service, first of all, by talking to them. We also offer them by giving them needed information, by providing them with directories and providing them with our counties that we serve, providing them with important phone numbers for BadgerCare, how to reach the advocates. If they were in need of dental, we will provide them with that dental information. We will also refer them to Nicema, who's our dental advocate. We will refer them to our vision, which is HRSLOB. So we provide them with the necessary needed information that they need. If they needed to just have someone to talk to, and maybe they don't know the other entities like MTM, which is our medical transportation company that deals with our transportation ride. We give them that information as well.
Okay.
So it's a whole wide variety of different information that we provide to our members.
That is a lot of information. So where do I go? Who do I call? What number do I call?
The advocate number is 1-877-900-2247.
And so what outreach does an advocate do?
Well, the outreach that we do outreach for immunization calls.
Okay.
We do outreach to members for just finding providers if they need a provider and they call us and they leave a voicemail saying, I need to help, I need a primary care physician for myself, I need a pediatric provider for my child. We then will go to the steps of looking at the counties where they reside in, the zip code, see which providers that's open and that they have openings. We even go to the point of calling the providers, conferencing in with the members to try to get them the help that they need. We also do, I stated immunizations, we do outreach for lead. We do outreach, just welcome calls. We do outreach for everything.
So I want to work back for a second to Danielle and to you both to answer this question perhaps. So one of the benefits I can see of you being in the marketplace and also serving not only children but adults is that when we call, so if I call for myself and a child, you know, and tell you that I'm a member for both of us, then you can help me identify doctor's offices that we both could go to or that would be in close proximity. Is that correct?
That's correct.
Absolutely.
Absolutely.
Okay. And what are your business hours?
Our business hours are Monday through Friday, and we start from 8 a.m. to 5 p.m.
So the number you gave earlier, is that a number where someone could speak directly to a person?
Yes, that's our advocate hotline.
Okay.
That's our direct advocate number.
Awesome. So what services does Children's Community offer in the community?
We give out information, just educating members, and if they're not our members, we just educate people in regards to Children's Community and the different things that we offer.
Okay.
So the different entities, the PNCC program that we offer, our utilization case management that we have, and our advocacy team that we have, the dental and advocates that can help them find providers, help them find dentists, help them find our vision plan. Maybe they don't know who they can call to help them. So we give them a wide variety of numbers to say, hey, you can call this number and you can get me directly and I can help assist you with your needs.
Now, help me if you give me a number and I'm struggling. So perhaps I called and I got 2 or 3 numbers. And I'm struggling. And so I call you back and I said, you know, I'm just having a hard time. What will you do in that situation?
If I get a call and a member calls me and they call 2 or 3 different people and they got the runaround, I'm directly going to help them right then and there. I'm not going to transfer them over to someone. I'm going to assist them with the needs that they might need right there. I'm not going to transfer them anything. I'm going to make sure that the call is completed so that they have whatever they need on that call.
So having heard that, I want to know, how can I meet my advocate?
Well, you can meet me. You can actually call me directly. I do have my direct number. I am out on health fairs. I do health fairs. I'm a part of a lot of community events that goes on in the city of Milwaukee, not only Milwaukee, West Dallas, and the counties that we serve. So we're always available. We have resource tables that have children's community information on there, and we're always staffing those tables.
Okay, awesome. So we've talked about a lot of things that advocates do. So is there anything else you want to add about what an advocate's job entails?
Most important things for members to understand that they do have an advocate that can advocate for them, and maybe they don't know it, but they do at Children's Community have members that advocates that are compassionate, and we love to help our members. And so at any cost, they can call us. We're not going to put them to the back burner. We're going to take care of the issues, and we're going to take care of them as they come.
Awesome. Well, thank you all for being here, and thank you for coming to answer questions. The Children's Community Health Plan, please go to the website at childrenscommunityhealthplan.org. That's children with an S. So childrenscommunityhealthplan.org, and look for more information. You have been tuning in to What's Going On, the Martha Love Show, and I am LaToya Sykes, your guest host for today. Thank you, and enjoy the rest of your day.
An MCM production.